Hello students, today we are going to discuss about anticholinergic drugs are the drugs which are going to act against the muscarinic receptors as well as nicotinic receptors. So anti-muscarinic drugs, those are naturally occurring alkaloids, example atropine and hyoscine. Synthetic atropine substance is also there. Then anti-nicotinic drugs are ganglionic blockers and neuromuscular. So again, here we are going to discuss about anti-muscarinic drugs. Those are atropine and its substitutes. Coming to that classification of anticholinergic drugs, they are also called as muscarinic antagonists, atropinic drugs, then parasympatholytics. So these drugs are subclassified into natural alkaloids, semi-synthetic derivatives, and synthetic compounds. So these synthetic compounds again classified into mydriatics, vesicoselective, anti-Parkinsonian, then anti-secretory and antispasmodics. So this is the classification of anticholinergic drugs. Here in this, among all these drugs, we are going to discuss in detail about atropine as a prototype drug. Coming to the mechanism of action, atropinic drugs, the competitive antagonist of acetylcholine. That means they are going to inhibit the acetylcholine receptors. So they compete for the same receptors, acetylcholine as well as anticholinergic drugs. They compete for a common binding site on the muscarinic receptor. The pharmacological actions are, so the actions of atropine and atropine substitutes, they act on the CNS as a stimulant as well as depressant. Stimulant action because of medullary centers. They stimulate the vagal, respiratory and vasomotor. At high doses, they are going to causes the cortical excitation, restlessness, disorientation, hallucination and delirium, followed by respiratory depression and coma. So CNA depressant action because of vestibular excitation, so that is going to cause the anti-motion sickness property. So that means it is going to act as a anti-emetic action. Tremor and rigidity in Parkinsonism improves by blocking acetylcholine overactivity in basal ganglia. So in this way it is going to act as an anti-Parkinsonian drug. Come to the effect on the CVS. So in the heart it is going to produces the tachycardia because of the M2 blockade and the M2 receptor blockade and the SA node. So initially it produces the bradycardia because of central vagal stimulation. Effect on the eye, the anti-autonomic control of iris muscles and the action of mydriatics as well as myotics. So because of the actions on the circular muscle and radial muscle which are present on the iris. So on topical administration, it is going to produce the mydriasis, abolition of light reflex and cyclopecia. So mydriasis means it causes the dilatation because circular muscle which is going to seen in the iris. So here what will happen is our circular muscle is innervated by empty receptor. When you block this receptor, it is going to cause the relaxation of the smooth muscles and causes the mydriasis. Actions on the smooth muscles. So all the muscles are going to be relaxed because of the empty receptors. So relaxation of the GIT causes the decrease the propulsive movement, results in the constipation. It is the marked adverse drug reactions of anticholinergic drugs. Urinary bladder causes the urinary retention. Bronchial muscle causes the bronchodilation. Biliary tract causes the relaxation. Then effect on the glands. So atropine markedly decreases the sweat, salivary, tracheobronchial and lacrimal secretion because of M3 blockade. Skin and eyes become dry. Talking and swallowing may be difficult. But milk and eye secretions are not affected. Effect on the body temperature. Rise in body temperature occurs at higher doses. It is due to both inhibition of sweating as well as stimulation of temperature regulating center in the hypothalamus. Then it has got mild local anesthetic action because of the release of acetylcholine very close to the receptors by nerves and involvement of the co-transmitters. Coming to the pharmacokinetics, orally rapidly absorb, crosses the cornea, blood-brain barrier is restricted movements, T half is 3 to 4 hours. About 50% of atropine is metabolized in liver and rest is excreted unchanged in urine. Coming to the preparations, zero point 0.6 mg per ml injection, then 1% eye drop ointment, then 0.6 to 2 mg IVR IM. Then children, the dose is 10 micrograms per kg. Then hyoscine hydrobromide 0.3 to 0.5 mg oral IM and transdermal patches. Coming to the uses, the first one is as anti-secretory. Uh, it is going to used in the pre-anesthetic medication. Then used in the peptic ulcer, pulmonary embolism to check excessive sweating or salivation. Example, Parkinsonism. So, because of the anti-secretory property, it is used in the pre-anesthetic medication. So, what is this pre-anesthetic medication? Prior to the anesthetics given in the surgery, we give some drugs prior to the surgery. Those are called as pre-anesthetic medication. So, when irritant general anesthetics were used, prior administration of anticholinergics like atropine, hyoscine, glycopyrrolate was imperative to check increased salivary and tracheobronchial secretion. So, they decreases the all the secretion. That is very important during the surgeries when you give the general anesthetic drugs. Then peptic ulcer, atropinic drugs decrease the gastric secretion and afford symptomatic relief in peptic ulcer. Pulmonary embolism, these drugs by reducing pulmonary secretion evoked by reflexly by embolism. Then to check excessive sweating or salivation. So Parkinsonism, these are the symptoms, excessive salivation and sweating. They are going to decreases all this condition. As antispasmodic, so it decreases the spasm. So intestinal renal colic, abdominal cramp. So symptomatic relief is afforded if there is no mechanical obstruction. So nervous and drug induced diarrhea, functional diarrhea, it decreases the propulsive movement, so it can be used in the non-specific diarrhea. Then irritable bowel syndrome, spastic constipation, the symptomatic relief may be afforded. Then pylorospasm, gastritis, nervous dyspepsia. In these conditions also we can use this drug. Then to relieve urinary frequency and urgency and enuresis in children. Then it is also used for the condition like dysmenorrhea. So these drugs are not very effective, but the commonly used drugs are NSAIDs. Anyway, we can use this drug as antispasmodic in all these conditions. Then it is used for bronchial asthma and asthmatic bronchitis and COPD. So they are going to cause the bronchodilation by blocking the M3 receptors in the smooth muscles of bronchioles. Then as mydriatic and cycloplegic. So mydriatic means it dilates the pupillary, causes the dilatation of the pupil. So this property can be used for diagnostic as well as therapeutic. Diagnostic means to check the refractory errors of the eye. Then therapeutically, topical, we use these drugs. Cycloplegia means there is a um, temporary paralysis of the eye muscles. So it causes the loss of accommodation and it causes the photophobia. Then it is also causes the cardiac vagolytic drug. Atropine is useful in counteracting sinus bradycardia and partial heart block in selected patients where increased vagal tone is responsible. For central actions, it is used for the disease like Parkinsonism. So Parkinsonism, what will happen? Increase cholinergic overactivity and decrease dopaminergic action. So to decrease the cholinergic overactivity, we use the anticholinergic drugs. It is also used for motion sickness. Motion sickness, nothing but it is used as an anti-emetic drug to antagonize muscarinic effects of drugs and poisons. So atropine is specific antidote for anticholinesterase and early mushroom poisoning. Atropine or glycopyrrole is also given to block muscarinic actions of neostigmine used for myasthenia gravis, decurarization of or cobra inversion. So these are the various conditions. To reverse this muscarinic effect, we can use this anticholinergic drug. So coming to the side effects and toxicity. So because of the exaggerated pharmacological action, we can see dry mouth, difficulty in swallowing and talking. Why? Because it concerned with the decreased salivary secretions. Then flushed and hot skin, fever, urinary retention and constipation, mydriasis, photophobia, blurring of near vision, palpitations, then excitement, psychotic behavior, ataxia, delirium. Then hypotension because of the histamine release, then C cardiovascular collapse with respiratory depression, convulsions and coma. So coming to the um, atropine poisoning. So at high doses or toxic doses, it the atropine poisoning symptoms are hot as a hair, blind as bat, dry as bone, red as beet, mad as a hen. So these are the characteristic features of atropine poisoning. So how to treat this atropine poisoning? So for diagnostic purpose, methacholine 5 mg or neostigmine 1 mg subcutaneous. If you give this drug fails to induce typical muscarinic effects, then you can confirm that it is atropine poisoning. Then how to treat the atropine poisoning? So if the poison has been ingested, gastric lavage should be done with tannic acid. Then the patient should be kept in a dark white room. Cold sponging or ice bags are applied to reduce body temperature. Physostigmine 1 to 3 mg subcutaneous IV can be given. It antagonizes both central as well as peripheral effects of the atropine. Other general measures like maintenance of blood volume, assisted respiration, diazepam to control convulsion should be taken as appropriate. Coming to the contraindication for antimuscarinic drugs, atropinic drugs are absolutely contraindicated in individuals with narrow idiocorneal angle, may precipitate acute congestive glaucoma. So they can also cause the rise in intraocular tension in patients with wide angle glaucoma. So caution is advocated in elderly males with prostatic hypertrophy because of urinary retention can occur. Come to the drug interactions. Absorption of most drugs is slowed because atropine delays gastric emptying. This results in slower absorption and greater peripheral degradation of levodopa. Less of it reaches the brain. This does not occur when a peripheral recarbolase inhibitor is combined. Then antacid interfere with absorption of anticholinergics, antihistaminics, tricyclic antidepressant, phenothiazines. Then many other drugs they have the anticholinergic property. If you use along with this anticholinergic drug, they show the additive side effects occurs with atropinic drugs. Coming to the important points for the dental students. So since these drugs causes the dry mouth because of decreased secretions of the salivary secretion, they causes the xerostomia. So what is this xerostomia? Drugs causing dry mouth. So because of the anticholinergic action. So all the anticholinergic drugs and some of the drugs which have the ability to produce anticholinergic like side effects. Example, tricyclic antidepressant, phenothiazine, first generation H1 blockers or antihistaminic. They do have this ability to produce anticholinergic side effects. So when you give this drug, they are going to cause us the xerostomia. So how to treat this xerostomia? So if it is not treated, this dry mouth condition, it can lead to the dental caries, fungal infection, halitosis and burning sensation in the mouth. So to treat this condition, we have to give the drugs like cholinergic drugs. So those are called as silogogues, which increases the salivary secretion. Those drugs are called as silogogues. So what are the drugs? Those are cholinergic drugs like pilocarpine and bethanechol. Then intraoral topical agents like chewing gums and candies. They increases the salivary flow in the mouth. Then saliva stimulants. So if you give the oral spray of malic acid and ascorbic acid, they stimulates the salivary secretion. Then salivary substitutes which improve viscosity and they mimic the natural saliva. So apart from the xerostomia, the patient on anticholinergic should be advised to maintain good oral hygiene. So otherwise it is going to cause us some oral related diseases. Then anticholinergic drugs should not be used in patient with glaucoma. Why? Because it increases the intraocular pressure and elderly males with enlarged prostate because of urinary retention and these are the various conditions where you have to um, see the use of the anticholinergic drugs. So anti-silogogues. So where the secretion is increased, salivary secretions are increased, they have to suppress the hypersalivary condition. So these anti-silogogues are used to treat the siluria. So what is siluria? Hypersalivation. To treat this, we have to give anticholinergic drugs like glycopyrrolate, scopolamine, and intraglandular injection of botulinum toxin. So these two topics are very important for the dental student. What is silogogues? What are anti-silogogues? Because these are the question can be frequently asked for 2 marks and for the practical viva.